Hello, my name is Dr. Brou, and I want to talk to you about body contouring today. And body contouring is a large spectrum that goes anywhere from just simple liposuction to major body lifting. But right now, I want to focus mostly in the tummy tuck or abdominoplasty, which is the name we know as. Um, so I have some illustration here to make a point of what is exactly the target of an abdominoplasty. But first I want to talk about who is a good patient for the abdominoplasty or the tummy tuck. So, okay, most of us have noticed that our tummies get larger and then sometimes it's a little bit smaller. But there are some changes that are irreversible, that won't come back. And those are mostly seen in women, and particularly women that have had children. So the typical patient for abdominoplasty is a young woman that has already had children, and they've noticed some changes in their tummies that are unacceptable to them. And those changes can be summarized in three. Number one is the skin gets larger. So there's more skin. It can be ripply and wavy, or it can have stretch marks, or it can have a fold right above the pubic area, particularly in patients that have had C-sections or cesarean sections. Sometimes hysterectomies are done that way. So the changes you're going to see is that the skin gets lax, sometimes it has a lot of stretch marks, and then it forms some folds, particularly in the pubic area, with some laxity of the pubic skin. All that can be corrected with the abdominoplasty. The second thing that we correct is the thickness of the fatty tissue or fatty layer, which is called panniculus in our scientific lingo. And so this can be reduced by a process of liposuction. The problem with the ripply skin is that if you do have a lot of ripply skin or wavy skin and you liposuction it, you actually make it worse. But with the tummy tuck, all that extra skin is going to be removed, so you can get away with doing a lot of liposuction. So that fatty layer gets thinner, and then your abdominal contour gets better. And the third layer of closure or improvement is actually the muscle layer. So most women will have some degree of muscle stretching with pregnancies, particularly if they have several pregnancies, or if they have a twin pregnancy, for instance. That's one particular situation where the muscles will extend. And I have a nice diagram here to, first of all, show you where the incision would be for an abdominoplasty. But here's an illustration of what happens to the abdominal muscles. So this patient who had a pregnancy or two will distend her abdomen, and the actual muscles will separate like that. And oftentimes you will see umbilical hernias or hernias of the belly button that come through. And those are very easy to correct in the process of an abdominoplasty. Now, this is called diastasis of the rectus muscles. It's a condition, which means separation. Sometimes this correction is done for medical reasons. But in the aesthetic world, which is where I am, we generally fix that problem in the process of an abdominoplasty or tummy tuck. This diagram here shows you that correction in a very simple way, which is done with sutures. So the muscles are brought together so that distension of the abdominal wall gets much thinner. And that's one of the things that I would do routinely in a tummy tuck. The second layer is the fatty tissue, which is done with liposuction. And the third layer, which is illustrated here with this, is the trimming of the excess of skin. Apologize. So what you see here is that the old belly button can be stretched out, and this is the level where you would sever the skin, so this skin gets removed. A new belly button is created. So what you're going to get is this correction of the abdominal muscles, correction of the excess of skin, so you can go to an improved result, which is what you see here. A flatter tummy with a mild scar, and a scar around the belly button, which is if done correctly, can be concealed very well. So this is the summary of what I had to say today for abdominoplasties or tummy tucks. Please feel free to call us if you want any further information or schedule your consultation. Thank you.